Vaccines contain an active component which is also known as antigen, which induce the immune response. They may also contain additional components such as preservative, additive, adjuvants, antibiotic, stabilizer, and other trace components. But how do vaccines work regardless of whether they target viruses or bacteria? Vaccines work by stimulating the body's natural defenses. The human body has an incredibly sophisticated defense system. The immune system is an internal army made up of millions of different kinds of soldier cells, lymphocytes, macrophages, and specialized molecules such as antibodies. This army has a very specific job to do: locate and destroy any infectious agent that enters the body. The better the immune system knows the enemy, the better equipped it is to fight. This is the principle on vaccination is based. Vaccination is a matter of teaching the immune system to identify the infection agent in order to neutralize it. It is also a matter of refreshing the immune system memory so that in the future it will be able to recognize viruses and bacteria. So the enemy is allowed to come inside in order to teach the body to defend itself, but certain precautions are taken like disarming it during vaccination. A bacterium or virus or one of the substances it produces is injected into the body. But first, they are weak sufficiently so they won't able to cause disease at the same time. They must remain antigenic, which means they are still able to induce a protective immune response.
The current development of vaccine are first, the improved potentially safer Zika vaccine. Researchers from Arizona State University have developed the world's first plant-based Zika vaccines that could be more potent, safer, and cheaper to produce than any other effort to date. They studied flaviviruses, which have the envelope protein on the outside part of the virus. It has 3 domains. The domain 3 has a unique stretch of DNA for the Zika virus, and then they exploit this to generate a robust and protective immune response that is unique for Zika. They first grew the envelope protein in bacteria, then switched to prepare the D3 protein domain in tobacco plants. After developing enough material for the new vaccine candidate, their team performed immunization experiments in mice, which induce antibody and cellular immune responses that have been shown to confer 100% protection against multiple Zika virus strains in a mouse challenge. The second current development of vaccine is 4-in-1 flu shot. Scientists from University of Nebraska-Lincoln have found that a vaccine combining centralized ancestral genes from 4 major influenza strains could be a path towards a universal flu shot. They studied the mechanism of the vaccines by using a mice, which is injected with unconventional vaccines, and survives exposure to latest doses of 7 of 9 widely divergent influenza viruses. Interestingly, those that received higher doses of the vaccines didn't even get sick. In contrast, a mice that received traditional flu shots or nasal sprays all sickened and died when exposed to the same viruses. The deadly pathogens were able to evade the immune responses triggered by the traditional vaccines. Weaver said that the ultimate goal is to be able to vaccinate once and provide lifelong protection.
Hi everyone, so now we are going to talk about current issues that related to vaccines. The first one is vaccine safety issues. Parents out there believe that vaccine can cause development of autism in their children. It's because of the content of chemically dangerous substance in vaccine that can cause harm in the body. So what's another current issues of vaccines that you know, Nani?
Okay, for the second current issue is it is claimed that vaccine produced contain religiously forbidden, that is haram substance, such as vaccine produced contain DNA from porcine. There is one Islamic country it is Indonesia. It produced its own vaccine that is called Pentabio. It is combination of vaccine to treat hepatitis B, tetanus, and diphtheria. Okay, that's all. And we have prepared some videos regarding people opinion about vaccine. So let's watch.
Hello.
Hello.
Hi.
Hi.
Okay, do you know what vaccine is?
I think vaccine is is a sort of or a type of medicine, right? Medicine or drugs that is used for the immune system in the body.
Have you ever been vaccinated before?
Yeah, I have. I think were given shots while in primary school. That's crucial for everyone, right? For every student, for every Malaysian student, and also I have been given the HPV shot also.
Do you know what's the functions of the HPV?
I think it's mainly for the health of women. It just reduces the chance of cancer, right? Cancers and also breast cancer or any problems that are related to the health of women.
So, do you know other names of vaccination other than HPV or something else?
Yeah. Some of what I know is that the ones they give to people who works in cafes who make drinks. What do they call that? Typhoid shots, right? That's one, and yeah, I only know the one, and also HPV.
Okay. If you would you like recommend the vaccination to other people?
Yeah, I do. For me, the typhoid is really useful and can be really convenient for those who want to apply to some jobs that is related to cafes or food, beverage and drinks, stuff like that. And I also know that HPV is really is it a necessity for women, right? Yeah.
I think that's all. Thank you for your time.
All right, thank you.
Hi.
Hi.
Um, can I know your review about the vaccine? Do you know what vaccine is?
Vaccine is something like you inject some germs or good bacteria to our body to promote growth of our immune system, something like that.
Have you been vaccinated before?
Yes, during a small age and extended sick for BCG.
Oh. Instead of BCG, do you know other names of vaccines?
I don't know.
You don't know?
Sorry.
It's okay. So, you said just now vaccine is good to boost your immune system. So, would you like to recommend vaccination to your friends?
Yes, I would like to recommend vaccination to my friend because it can prevent disease and prevention is better than cure.
Hi.
Hi.
So I have a few questions for you.
Yeah.
For the first question, are you vaccinated?
Yes, I am vaccinated.
So if in future you have a children, do you plan to give them vaccination shot?
Yeah, I will give them vaccination shot.
Um, what's your advice to people who don't give or afraid to give their children and family a vaccination?
My advices to people who are anti-vaccine is they should allow their children and family to get vaccination because it is important for us to keep healthy and we can by vaccination we can defend ourselves from infectious disease.
Thank you.